Executive Director of the Ruby A. Neeson Diabetes Awareness Foundation. And for those that don't know, and I'm sure most people that are joining already kind of know me, but the Ruby A. Neeson Diabetes Awareness Foundation, we're a nonprofit organization. I like to say we're a social service agency. And we're working to bridge the health equity gap. And we do that by addressing diabetes as a community. So I'm super excited because I have an expert. I have one of the diabetes community here in Metro Atlanta or in the state of Georgia expert here. She is a phenomenal healthcare professional with many years of experience, although you probably can't tell because she looks so young, but she's going to be here to share
Thank you.
just some insight from a clinical perspective. So you guys know I am a community health worker and I don't have a clinical background. I am just someone, I lost my mom she passed away from complications of type 2 diabetes, and I just wanted to make a difference. And I've been able to do that with the very unique role of a community health worker. But outside of connecting people to resources, I don't have a clinical background. So what I do is mostly health coaching and also promoting the importance of taking ownership of your health and just overall self-advocacy in healthcare. So I'm happy that we have a clinical professional, one of the best here, that will be speaking with you. Um, so before we actually start, I want Dr. Jasper to introduce herself, and then I also have a special guest, Dr. Michelle. She's joining us today. She has a story that she's going to tell. I was moved and inspired by her story, but I would like for the guests to introduce themselves. So, Dr. Lisa, can you start just who you are and how you entered this diabetes community? A little bit about your background.
All right. My name is Lisa Jasper. I've been in healthcare for over 26 years. Have to move those years up on my resume CV, but I've done a plethora of different clinical experiences. Started off as a nurse. I'm from Detroit, Michigan, and I went to school there in Ypsilanti at Eastern Michigan. From there, came to Atlanta, a nurse practitioner, and I worked in cardiology, research, retail health, med surg, you name it, endocrinology. I've
Wow.
done it. Um, and as currently in the quality leadership role, in corporate and have my own business and consulting world. And my background has been in diabetes for the last 10 to 15 years of building clinics
Okay.
within organizations from inception and developing them with the teams in primary care, getting them recognized by the American Diabetes Association,
Mhm.
doing billing, coding, marketing, everything for clinics in that way.
Okay.
Um, my passion just became diabetes in the last 10 years. And I'm like, this disease process, we haven't moved as much as we needed to. And just trying
Mhm.
to figure that out and trying to see what I could do as a
Mhm.
healthcare provider, and to help different communities build different movements that they can help do some of the work. So I've just been on a mission that way of thinking of the poor and elderly. They're always at the top of my list when I think about how we can make resources available for them
Yeah.
and giving them the knowledge that they need so they can improve their health in any of the chronic disease or comorbidities that they may have. So that's been my process. That's been my background. I can go on and on. So I'm going to stop there, but I'm excited to be here. Miss Motima, I am so excited for your organization, and there's so many things that community health workers can do,
Mhm.
and I am excited to do that work. And with you, that would be great. I'm just excited to get it done.
Well, thank you so much. And I really appreciate you being here, Dr. Jasper. We actually, I don't know, we met probably, it may have been over a decade ago through John Riley and the Georgia
Mm-hmm.
Diabetes Coalition. And I always said, I want Lisa Jasper on my board. I gotta have her on my Lord. But so this is like a full. It just means so much to me because I know you're very knowledgeable, and you mentioned seniors. They are the driving factors of diabetes, specifically type 2. But I'm just so I'm in the community, and I'm really shocked to see so many younger people, even children, that
Mm-hmm.
are
Mm-hmm.
predisposed or that already have, they're heading towards type 2 diabetes. So this is
Yeah. Yeah.
a very important conversation because I'm often asked, well, what are the signs of diabetes? And a lot of times people think when they think of the symptoms, it's something that's like a myth or something that's not necessarily, there's a lot of myths and misinformation about diabetes or type 2 diabetes. So that's why I wanted to have this
Yeah.
conversation. And I want to introduce Dr. Michelle. I met her in the community years ago. We're also a part of another organization, one of our partners, Simplistic Restored Living. I have to give them a shout out. If people still say shout out, I want to shout them out. Simplistic Restored Living, and they're our housing partners. And she was recognized through that organization. So we had a conversation recently, and she shared with me her story. I said, I want you to share your story on one of our engagement forums on how you found out that you were at risk, or that how you your road to type 2 diabetes. It was a fascinating story. So I want to introduce Dr. Michelle. Would you mind sharing your story with us?
It was just a little introduction because
Okay.
in doing this awareness, and thank you again. Nice to meet you, Dr. Jasper.
Nice to meet you, Dr. Evans.
Know that you just amazing. I love your spirit, your smile, everything about it. You were just like one of the people I was like, let me call on to talk about this. Well, I want to say hello to everyone in Facebook audience. How we're doing the recording, the people that's on here.
Yeah.
I am Dr. Michelle. I'm honored to discuss diabetes awareness today. Um, I'm a mother of three and a grandmother of two grandsons.
Mhm.
My doctoral degree last year, which I call my Black History because it was February 17, 2024. And I'm proud native of Atlanta, Georgia. Um, my mom passed recently. My father, nearly 77, continues to inspire me with his active lifestyle. He's still working. And while diabetes isn't hereditary in my immediate family, I've seen the effects on distant relatives, but my perspective changed on August 1st, 2024, when my yearly physical revealed that my blood sugar had crossed into a diabetic range. Despite commitment to health, I was shocked. I was fearful. I was telling Martina, it sounded. I have my doctor of 23 years, my primary doctor. He's been my primary doctor for 23 years. So I was explaining to her that you have a relationship with your doctor. He knows me, my family, my husband. We're not my husband, my children. He just know my family. And I remember, I will never forget this day. I was at home, um, and I received a phone call. I had went and had my physical done, and we'll go back to leading up to that. Um, I had blood work done, which I usually do that yearly. But I received a phone call from Dr. Jingo, and when he called, he had said to me that I need you to put the Coca-Cola and the sneaker down. And I was like, well, Dr. Jingo, I'm really not drinking Coca-Cola and sneaker. I moved on to another favorite or something I like. He was like, I was just working last night and I saw your blood work and your sugar, your AC1 has risen up to 5.7. And that means that you're not even in the pre-diabetic. You are now crossed over into being a diabetic, having diabetes. And I sit up on the bed. I remember it was like 9 o'clock in the morning. I sit up on the bed and all I heard was, you have crossed over to the diabetes point. And it sounded in my ear like, I was telling Martina, it sounded like hearing something I don't want to say death sentence, but it sounded, because I've always been healthy. I've always been active. And I didn't, in that beginning, when he told me to have any signs or anything. And so some of the signs that after I spoke with him, I remember I was telling her that I love my hair. Yeah, I love my hair. My body was giving me signals. Prior to Dr. Jingle calling me, I remember going to get my hair done. I would go get it done every 2 weeks. My the beautician I was going to, anywhere I go, I try to go for a long period of time because I get used to people. And she was like, Mama, we cannot do your hair anymore because I was getting these white patches in my hair. And no matter, I would just get it washed. And as soon as I get it washed and done, and when I would get home, the patches would start back arising. You would see them again. And so it was strange. So I would call my mom. She was living then. I called her and I was explaining to her. She was saying, well, go get this at the store. Go get some stuff for, the old remedy of getting things. So I was telling her, that I was spending so much money on hair products. And then there were other signs that were happening. We're all grown on here. I was having a itch issue. Being adults, that in that moment in a time that I wasn't, and it's okay I say this because I want their sign, the signal. I mean, any signs that you have. I wasn't sexual active. So I had already had my physical, but it was just the itching, and I was being, sometimes in our culture we're afraid to even discuss those things because you don't want nobody saying blah blah blah. But I knew that my husband and I had been separated for a long, long time, and I wasn't active. So I was doing things at home to try to fix that remedy, right? Um, so that's when about 3 months later, I went to I found a great dermatologist because I think it sounded weird. And I was telling when I was telling her my story, my hair, yet all of this other stuff, the breakout in my chest, the itching. But when it came to my hair, it was like, okay, find your doctor. Weird, but yeah, but find your doctor. I found me a great dermatologist in Buckhead. She was a black female dermatologist. I went to her, and when she sat me at her table and she began to uh, spread my hair. Well, first we did a virtual because it was like during the pandemic, and she said, take as many pictures you can. And I shared the pictures one time on Facebook because I wanted people to know, but I didn't know what the issue was. I was just sharing my story about my hair. But she began to spread my hair apart, and I'm trying to say this as best as possible. And she looked at me, and she looked at my hand and my feet, and she said, I want you to hurry up and go get a diabetes test. And I was like, okay, what do my hair and diabetes has to do anything? Okay, so she gave me some medication. The medications that she gave me, it actually healed the part that was going on with my hair. So I was like, okay, well, let me, I'm gonna wait around, how we do. Well, I'm gonna say how I did. So then that's when I had my eye exam. And I was telling Miss Jackson that I went to my eye doctor that I have yearly done my eye exam, and my eye doctor kept saying, your eye pressure is just not good. I need you to go to an eye specialist as soon as possible. I was like, girl, in my head, I didn't say girl to her with respect because I know her. I was like in my head, like, girl, I don't have no high blood pressure. I've never been told that I have high blood pressure, but it was the pressure in my eye that was another signal or sign that my body was telling me, hey, this is getting out of control, and we're fighting it with everything in your body that you have. So I ended up going to this eye specialist. I remember, and I was telling her when I pulled up, what frightened me was people that were much older than I were, and they were elderly, and they was getting out of the car and they had canes, and I'm like, what is this? Oh my goodness. So I went in, I saw the eye specialist. He examined my eyes, and by the grace of God, he said that your pressure on your eyes are an experience, I believe. He said the same thing the dermatologist said from diabetes. But me not knowing what was going on, I was like, okay. He said, but your eyesight is well. You haven't lost any of your vision. We don't see any glaucoma. We don't see anything. So I was like, okay. Um, Still in my mental, I was I was afraid to go back to my primary care, who I've known for 23 years. When he called and told me that, I still didn't. So I went on this 90-day cleanse. I changed my mindset. I said, I'm gonna go on this 90-day cleanse because I had in my mind as growing up, like I said, hereditary. I never had, my parents have never been diagnosed with diabetes. I didn't know any close relatives, but I know, like, maybe my grandmother's sister, when she was older, they would call it sugar. Back in the days, they would call it sugar. And I remember I had a in-law. Well, I had a cousin who was married to someone that had diabetes, and I noticed, I would see distant relatives that had diabetes, but it was never around me as close. So I went on a 90-day cleanse. When I say 90 days, I went from no sweets, no sugar, high protein, losing weight. I'm like, because I am not, this is my mentality. I am not going to be on anybody's medication for the rest of my life. I would never see myself shooting insulin in my body. And those were just some of the things that I stuck with. And I'm a woman of faith, and I was just so afraid of being that person that would have to have a bag of pills and sticking yourself in the stomach. And this, I was not going to do it. Well, during that 90 days, I discovered by researching, I was telling Miss Jackson that there was a product that I saw on social media. It was a banana nut. It grew in the West Indies. It's a brand that a young lady came up with because her sister that was young had diabetes. I guess type 1, because it's basically in kids young when they're younger. And she made this out of some kind of type of banana that they have in the West Indies that they grow, and it's called like a banana nut, but it's a natural thing. So I purchased it, and it worked, but it was a gut cleanser, and I can feel it actually cleansing my gut. It was like, I could just feel it. So I would check my blood sugar level every day, and it was like at the normal rate of like between 85 to the highest I ever got between that time was like from probably 78 when I went out of town to eat in Houston, which their food is delicious. It was like 120. So I think, okay, now I have this thing under control. So that was 3 years I went by trying to fix the symptoms myself when I've been going to this doctor for years for everything. But when that call that he personal called me, it was like maybe if somebody get a call and say that they have a sickness, I took it serious, but I was very afraid. I was afraid, and even but Tim was telling me, I didn't even know that you dealt with that, and I was telling her, you know what? I don't think nobody really knows that I actually went through that process, those things. So August said we're going to go ahead and go further. So August the 1st of 2024, I am a consultant. I work in the political arena. I work in the community. I work with a whole lot of people. But I remember last year, my daughter works for Delta, and we get to travel all the time. But I remember not wanted to do anything. I didn't know. I kept telling my family, like, it's something going on with my body and I don't know what's wrong. I can feel it. And I had gained a whole, after I did the 90 day straight, strictly no sugar eating, healthy, I lost a lot of weight. But in my mental, I felt like I lost a lot of weight. And what would people be saying about all of this weight that I lost prior to another story we'll get into? Um, when you are in certain cultures or family and you lose weight, people want to put false narratives out there. So I was like, in my mental, I kept saying, I'm getting skinny again. And I don't want to get skinny because I don't want people to go back to my story when I had postpartum and they didn't know what was going on with me. And I was losing weight because I didn't have a desire to eat. I was just functioning and didn't know what was going on with me in that area. So I started back with the bad habits. Started back eating whatever because I was like, I got to put this weight back on, put some of this weight back on. But as I look back at my pictures, I looked amazing, right? Uh-oh. So what happened? I ended up August the 1st, 2024. It was our family reunion. I had been working the political campaign for the Democratic Party for Vice President Harris.
Hold on 1 second. Dr. Michelle, I think your camera is off.
Off? Did it go off? Okay, I did. Okay, thank you. So
Yeah, and I want to ask you, but go ahead because I have a question, and then we'll get to because I have some questions already for Dr. Lisa. But go ahead, go ahead.
Go ahead and get to this part so I can get you to the part where I found out what they actually told. So I was sitting here in my home now. I was getting ready for the family reunion. I had, like I said, prior to that, maybe 3 months straight, I was not feeling well, but I was working. I was in project management. I was working, and I would just come home, and I didn't have no energy. I wouldn't eating. I just didn't feel good, but I made push myself to get to work, do what I had to do, and those things. But I was taking a shower. Once I got out of the shower, I was getting ready. And all I remember, you guys, is that I was sitting on my sofa trying to put on my clothes, and my hand, the right hand first, completely went like this. It bent. I tried to practice, so I wouldn't cry. But I remember calling my son. I was calling him so loud. I was like, come help me, come down now one. I'm having a stroke. I'm having a stroke. Now, this is a person that has not had any health issues, but just been told maybe 2 years prior to this, leading up to August the 1st, 2024, that I had passed the limit of diabetes. I mean, pre-diabetic, and over into 5.7 my AC1. So I was just remembering telling him, go in the kitchen and get my oil. And I was taking my oil, rubbing it on my hand, and I would sit on my hand because I only thing I could think in my head, if this is happening and I'm having a stroke, Lord, whatever's going on, take care of me, but do not allow my hand to be like this, bent over. And so I was able to some kind of way get my hand up under me so I can sit on it so that I can flatten it out. And I just wanted to keep it flat. So he dialed 911. 911 was questioning him to do these different signs, do these different things to check and see if I was having a stroke. So I was passing that. So about 5 minutes later, they got here really fast. I live in McDonough, Georgia. When they came in, as they was coming in, everything like this went this away. Everything. And they was like, we have to find out what's going on. So they was working on me, working on me. So the spasm left, and they did the stroke test again. Hold your hands out. Do the whatever the stroke. I can't remember everything that they did that particular day. But I remember him saying, "It's something going on. It's something going on." So he asked one of the one of his coworkers to go out to the ambulance truck and get his sugar meter to read. He brought it in. He pricked my finger. He said, "It's not reading." And they looked at each other, and I'm looking like, "What that mean?" He said, "Get her to the hospital right now." And I'm like, oh my goodness. He said, you need to get to the emergency right now because if our reader is not reading your sugar is so high that this machine is not reading. Get to the hospital. And I was like, okay. I was like, can my son drive me to the hospital? He would look at my son. He was like, get your mom to the hospital ASAP. And then my son was like, come on, mom, let's go. I was like, okay, let's just stop at the just I don't know. I just wanted to stop at the family reunion. So I stopped at the family reunion. I pulled my dad to the side and I told my dad what was going on. He was like, get to the hospital. So I was able to speak to everybody. Nobody knew. then. They were like, "You look so pretty," da, 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 but nobody knew. I went to the emergency room. They rushed me to the back because they wanted to do neurologist tests. They wanted to make sure I wasn't having a stroke. They wanted to see what was going on. They wanted to make sure my kidneys wasn't damaged, my heart wasn't damaged. They put me in ICU. They said, Miss Michelle, you are very sick. And I'm looking like, what do that mean? I'm very sick, because I felt tired, but I didn't feel like, sick. They said, you're very sick. You have depleted everything out of your body. You have no potassium. They were naming other things. I can't name the medical terms. Your AC1 is 12. Was it? No, it was 10.8. 10.8. And we have to put you in, they call it IMCU when you're doing the IV drip. I think it's IMCU, I think it is. They had to do the insulin drip. They had to do so much potassium, which was the worst. The worst. It burned so bad, but I had a fantastic nurse who came in and kind of diluted it. But I today, and I stand before you all because I wanted to share this story, because I had not shared this story. And when I started sharing this story with other people, people were saying to me, I have them symptoms. And I was like, please, whatever you do, go get checked, because they kept asking me to give them my dermatologist number so that they can go see what's going on with the white patches in their hair, on their scalp. And I kept saying, no, I'm sure it's probably deeper than that. Please go to the doctor and get yourself checked. I've been on a study. I went to my primary doctor when I got out of the hospital. They had an appointment available. There I met a amazing nurse. I met my doctor is already amazing, but she told me then, we're gonna beat this thing, and I see that you're determined to beat it. And I was like, yes. Yeah. So she told me about this program. I'm on a study right now. So as of today, which is February the 26th, I went to the doctor on Monday. My AC1 is now 5.4. I was swole. I say swole. I was 230. I'm now 213, healthy,
Wonderful.
losing weight. So I just want to
Wonderful.
share that story, just to give some kind of signals of what I was having, that was going on with my body. And I see my mentor here, Dr. Nelson. She didn't even know. No, but I ended up telling her. So she's gonna write my, well, I'm saying this, throw you out here, Doctor. Now she's writing my book. And she was ready to write it, but I said I spoke with one of my amazing friends, and I told her my story, and now I have to add this. So she's so excited about this being a part of my story.
Wonderful.
Thank you.
Wonderful. I jotted down, I know Miss Matima had some things, some questions, but I jotted down a few things I wanted to, just that I heard and I wanted to speak to.
Yeah, first of all, thank you so much, Dr. Michelle, and welcome, Dr. Nelson. I'm a writer also, and I always say we always have a book inside of us, and that is a part of our legacy. If you're able to write a book, and that it lasts forever. So I'm excited, looking forward to reading your book, Michelle. And I know it's very emotional, because I was emotional when I heard your story, because I have a family history of diabetes. And even when I say diabetes, that die, it comes like in my mind, like, oh, it's a death sentence, but it's not. But I've lost so many family members, and I've always heard it runs in your family. And although there is a hereditary component, we do have a lot of unhealthy lifestyle choices that we've made throughout the years. And I get emotional also, but I'm happy that you were able to, that you're okay now. And that's why I invited Dr. Jasper here, as a medical professional, because sometimes we miss those signs. We don't realize our body really does talk to us, but we mask a lot of the symptoms with either pain medication, or like you said, you just wanted to go to the family reunion. We want to be there for our family. And, but sometimes we put other, I'm not saying the family reunion was a crisis, but we can't take on so much. Our body isn't designed for all that, I don't think. So we can't do too much and overstress it, overload it to where we're not taking care of ourselves. But the first thing, before I talk to Dr. Jasper, let's say this, it's A1C, because a lot of people don't know. I can't hear you, Michelle. What was it?
What did I say? Because I get it wrong all the time.
Yeah, it's hemoglobin A1C.
Okay.
You can say H, hemoglobin A1C.
A1C. Okay.
And you got to know those numbers because anything below 5.7 is normal. Once you go 5.7 to 6.4, that's prediabetes. And 6.4 and above, that is diabetes. It's about 38 million people in the US as of 2021. So we don't even have the statistics now that have diabetes. But we know if it was 38 million people in 2021, it has to really be over 40,000 people, 40 million, I'm sorry, 40 million people. They have diabetes and 90 million have prediabetes. So they're going to tip into it. And a lot of things that you said, the fatigue, the dry skin, all those things just represent high glucose in your blood, and it's just circulating in the blood. And so what that hemoglobin A1C is giving you the percentage of sugar that's circulating in your blood. And back then you had 10 or 12% back then when you didn't even know. And then you did some working out and doing some, that 90-day cleanse, or what were you doing? Or were you exercising? Were you just cutting out foods that were sugary?
Yes, I cut out food. I had I remember I was saying I ordered the banana nut that's from the country that they use for diabetic patients. I ordered that, and it was like you can make it as a smoothie or you could put in your coffee, and it was like a gut cleanser. It would cleanse the gut out. So I did that.
So there's so many sneaky things that sugar hides in. And I always talk to my husband about it. And like the first thing is like, I stop eating sugary drinks. But the sugar is in the bread. The sugar is in the pasta. The sugar is in the rice. And let alone all the sweet things that we eat. And we just don't pay attention to it. And that keeps our sugar up. And so when you said you were fatigued, all that sugar is just mounting up in your bloodstream and it can't get into the cells to give you energy. And that's why you're feeling punky and fatigued and you can't do anything because it can't get in there. And we didn't have this problem years ago. I'm like 50, 75 years ago, people ate at 5 o'clock and there wasn't much snacking. And we ate and we walked and we did chores and stuff outside. I'm acting like I was back then at that age, but this is what I heard. And so now we just eat throughout the day and things that, we shouldn't be doing. And so that's how it comes on. This didn't happen. All the processed foods that we're eating now, and they say eat every 2 hours. And like that, we didn't need to do that. Once our insulin comes out of our pancreas, we wear it out. We wear our pancreas out. And I always say our pancreas is a large muscle and you wear it out every time it has to squirt some insulin out to take out that meal or that sugar to bring it down. And so another thing, the dry skin and the weight loss. And one of the things you said about the weight loss, you were feeling insecure because you were losing weight and then you want to put it back on. And that's one of the stigmas in the Black community. We don't want to look thin. And the weight represents health to us healthy. And we won't want our relatives talking about us. And so I know it's just something that's there. And we got to get away from that. We got to get away from that. Our body will tell us if it's healthy or not, but the weight, it just causes problems. So hypoglycemia, I don't know if you recognize the symptoms of hypoglycemia. Do you know what that looks like now?
So on Sunday, because again I'm in a study on Sunday, the study is a pill bottle that we have. I have the brochure and read up on it, and I trust my physician of 23 years who was able to get me in the program.
Mhm.
So I'm on my third bottle. So each bottle, whatever they don't give me the name, but whatever bottle I'm on now is has increased in whatever they have in it. So on Sunday, I had a major breakdown. I didn't tell Dr. Nelson. We had a service for veterans, and she brought me home, and we did stop and get something to eat. But I checked my blood sugar when I got home, and it was 57.
Mhm.
I
Mhm. Mhm.
went to I went to a place where I was like, it kind of put me in a funk. So I called my nurse. She wasn't able to answer. So I don't I don't keep candy and sweet stuff around here because
Mhm.
I have not had since I've been on the study. It's kind of level where they have not had to increase any insulin or increase any medication. Everything I've been doing is being decreased. So what happened is now since all of these things are happening, now I have to learn how to train my body to eat healthy, but I have to make sure that I eat. So I tried to eat on something that particular day what we ordered, but it wasn't good. But I didn't know the height. Can you say the word for me? Because I'm always
Hypoglycemia. That's when your blood sugar is low,
it was very
usually below 70, and you
yeah.
start feeling shaky, dizzy, irritable, hungry,
But
confused.
I did not. I did not. I did not experience that. So when I saw the 57, I was like, "What in the world?" Because I did not feel any of that. So I couldn't get my nurse on the phone. So the first thing I did start researching. I remember her saying, "If that happens because you're on a new bottle, make sure that you have some orange juice, some candy." But me,
Mhm.
I didn't have any. My son happened to have a piece of candy, and I remember unwrapping the candy and I was chewing on the candy, and 15 minutes I waited, I took it again. It only went up to 63.
Mhm. Mhm.
Oh, I know you're telling the story. What is going on? I'm not going to no hospital. And so I waited and I called her back. Because she had told me prior to our visit, if that happens back to back, please call her. So I called her to give her the readings, and
She went.
Uh-oh. I think we lost her for a second. She'll come back. But I do have, and I want to say hi to Jamasina. She's watching on Facebook and her organization up in Maryland. We had talked about that's why I'm so happy Dr. Lisa Jasper is here. Because we had talked about this is a true story, everyone. This is when I said, wait a minute, we really have to the clinical and the community health workers, we really have to come together so we're giving the correct information so we can build some really good positive outcomes. But I had talked to a Mother's Cry organization in Maryland, and we had talked about a diabetes remission program because she said it's so many people here with type 2 diabetes, they don't want to be diabetic anymore. And I heard diabetes could be reversed or it can go into remission. So we need to do that program. I said, yeah, we should. We should. I hear that it can go into remission at a certain time. So we're gonna do that, and we start promoting. We're going to go into diabetes remission. Well, honey, I was talking to Dr. Jasper. Hold on one second, and I'll get back with you, Michelle. I was talking to Dr. Jasper one time, and she said, "Not if the beta cells are damaged." I said, "Whoa, wait a minute. This is a conversation." I Yeah, you said not if the beta cells are damaged. I said, "Wait a minute," because you're right, and we can't. What may work for someone may not. And that, when
Yeah,
Dr.
it may not
Michelle
work for someone else.
may not work for
But it
someone else.
depends on when you were diagnosed, because most people,
Right.
diabetes has been in their trajectory for 10 to 15 years. And
Yes.
it doesn't just happen overnight. This is stuff that you did 10 to 15 years ago. I'm not
Mhm.
saying you did, but just as your body. You go through stages. You go through insulin sensitivity, you go through insulin resistance, then there's pre-diabetes, and then diabetes happens. So you've gone through all the stages, but that's over a trajectory. So it just depends on where you're in your trajectory. Say if you're at the pre-diabetes and just got into diabetes and you want to try to reverse it, but reversal is no medications and hemoglobin between the 5.7 and 6.4 for 3 months at least. And this is what I wanted to ask you, Dr. Evans, what medications? I know you're on a drug study, but did they take you off of your medications? And did your doctor, and what medications did they put you on?
Yes, they've taken me off my medication. I'm using it starts with the B, insulin vascular. Am I saying it right? Correct? Vascular.
Well, she's
That's okay.
getting that. I have a quick question for you, Dr. Jasper, because we know that diabetes could affect just so much in our body. How does it affect women and men different? If you want to answer that now, you can, or if you want to go back to Michelle, but if you can jot that down, we want to know, how does it affect men
Well,
and women?
we store our fat a lot differently than men, and our hormones are affected by insulin. Insulin is the main insulin is the main hormone that affects so many different things. Your cortisol levels, your FSH, it does so many things. When that is out of whack and when that's elevated, other things go down. And so we want to make sure that is where it needs to be. So that helps with exercise and eating right. And I know the key to eating right all the time, and I had to learn it. We want to say don't eat any carbs, but you can eat carbs, but you can't eat them in isolation. You can eat them if you pair them with the protein, and protein has to be your best friend. Protein has to be your best friend. You can eat protein all day, but if you're going to eat eggs, if you're going to eat some grits, make sure you have some protein to line that stomach first. If you're going to eat some rice, make sure you have some, a chicken or a steak first. And it's about how you eat to prevent those spikes. There's so many different tricks to it, but you are going to learn and you're going to be the expert with it too, because I can see you're getting it. You got it. Learning all the medications, learning when to eat, when not to eat, and what. But you got to know that center aisle at the grocery store is the devil. And I always, when I get stressed, I know I go for my chips, and I know it's wrong, and we do fall off, but we got to know how to get back on.
Yes.
So going back to those symptoms real quickly, did you have any blurred vision?
I did not have blurred vision. I just remember my eye doctor speaking on the eye pressure. I didn't.
Okay.
I didn't. I didn't have blurred vision. And so, as I said, when I took my yearly eye examination, it went well, but she was just concerned about one of the eyes with the pressure, and that's when I went to the specialist, and he examined my eyes and said that there were no loss of my eyesight. My eyesight was well. Even in the study, you have to take the eye test and all this good stuff. So so far, everything, all my blood work with my kidneys,
Okay.
with my liver, my potassium. I just went Monday. They were a little concerned at first with my liver, and I know what that came from. They asked me, "Do I drink?" My nurse did, and I was like, "No, I don't drink." But I was taking Advil PM on a regular basis. So when she told me that, she said, "Get rid of them." And I remember, like, I was telling somebody that I had just spent like $8.99 for 20, but I threw them in the trash so fast. So I have not had an Advil PM in almost a month. I went to the doctor on Monday, and my liver results came back amazing.
Good.
what else they were concerned about. Kios, how do you start with the K? Kio, I cannot think of it. I Googled it. I think that had something to do with my potassium. So they put me on some potassium pills. Um, the results came back with you have in the study you have to take blood work a lot. My potassium came back excellent.
Good.
She was concerned about Monday I had to take my cholesterol.
Yeah, okay. Okay.
Was concerned about my cholesterol. So only thing that I'm taking now that my doctor gave me is calcium. The name of this insulin, it starts with the BASAGLAR.
BL.
BAL. BASAGLAR. It's the
Oh, Blazer. Yeah. Okay. I know
yeah.
what you're talking
So
about.
I started off with 28 units, and now I'm on 10 as Sunday when it dropped to 57. So now I'm on 10. I was told on Monday within maybe a month or two, I will not be on the insulin because when you start going down, Dr. Jingo said to 10 and that it's really not necessary to have it. So he wants to try it out for at least 2 weeks to another month because I have to do my blood. I have to do paperwork. I have to prick my finger. I have a phone that I use. I have to record it in there. I have to take the capsule, and everything I have to report, and then you get a little stipend for doing it. But everything is just looking well, and he's amazed by the weight, and I'm amazed because I was like, listen, and losing this weight was just like the hardest thing for me at one point because I felt swollen. I was tired. I'm energized, like I can't tell people. When I realized that what the sugar was doing had, like now I'm like, but I have so much more energy.
Yeah.
Amazing that I've learned. Sometimes I have to still trial and error figure out the eating part, but I try to.
What are you drinking in your coffee? What are you putting in your coffee?
Okay, so what I'm using, I try to drink a cup of coffee maybe once, twice a week. I haven't had any of this week, but I'm using. Is that Trulicity? What's the name?
Truvia.
Everything, y'all. No, Truvia.
Truvia, yeah.
I'm using Truvia and coconut milk.
How many carbs in that coconut milk?
There's carbs. So it's 2 grams and it's 1 gram of sugar, but no zero added sugars. So I was told that maybe I want to try almond milk. But I don't eat cereal or anything. I had before I even got to the diabetes thing, I had been stopped eating cereal. So I only use this just to put in my coffee. That's the only reason I use it. And I only use this to sweeten my oatmeal, but I use my oatmeal with bananas. That's the only reason I use it. I don't use a lot of it. But almond milk had a little more than coconut milk. A little more carbohydrate, however you
carbohydrates.
right.
But yeah, always look at those labels.
Okay.
Because that's just in a serving. That's not in the whole thing. So you got to look at how many scoops that would be if it was grams and you translate it to scoops of sugar. But just walking after every meal, just walk for 15 minutes, and the whole idea is to prevent that sugar from going up. If it's headed up, walking will suppress it. Doing any type of exercise will suppress it. And I love your story, and it's a story so many people will have that they don't know, and they're having these symptoms throughout the years that they just have no idea. It started off with your hair. And all this comes to mind with how I started my organization, was thinking of the lay person that could have diabetes, and they go to their hairdresser a lot. And I'm like, well, a hairdresser could, learn the signs and symptoms of diabetes. A nail tech could. Your CNA could. Your community health worker could learn all these things because they come in contact with everyday people. And I was like, why can't they be the coaches and pseudo educators that can help with this? And so that's what the movement is it about, these everyday people to be these advocates for people, because you go to your hairdresser regular, then you see your primary care doctor, and she could pick up on that, just knowing, wait a minute, this scalp is pretty dry, why is her skin so dry like that? Or the nail salon looking at the bottom of your feet, and now you're diabetic, you should know, and they should know not to cut your toes so close. They be filing something crazy, right?
Oh,
And
yes.
just
Oh,
cutting down
yes.
so low. But those are the people that need to be educated. And if we can't educate them, it's educating the person like you so you can educate them too. So my company is called Mind Your Business Type 2, but understanding that to be in business, you're going to come in contact with so many people that have diabetes, and you need to have a glimpse of, what these signs and symptoms are. If people pass out, people have strokes in the chairs of the hair salons. They have many, what do they call it? When they're putting their head back into the bowl, they have strokes all the time.
Yeah.
And what you should do. So I'm just passionate about educating people that have businesses, along with people with diabetes that can come and know these signs and symptoms and things to do and when to seek help,
Yeah,
with
and let me
educating
say,
them.
I'm so sorry, Lisa. I didn't want to interrupt you. And let me say, we have a couple more questions, but if you're watching, if you know a hairstylist, if you know a nail technician, you can also, through Lisa's program, Mind Your Business Type 2, you can have access to her. Where she can answer more questions, you'll be trained. So I just wanted to make sure, because that's a bonus for your program, to have
Mm-hmm.
that expert access to you, because you have just so much valuable information. There's a troll, someone's trolling us on social media. His name is George, my husband. He's want to tell everyone I need to stop doing the Advil PMs. I understand, because I take them at one point, but a nurse told me that I can take it every night. I know
And,
that sounds
and
crazy
no, I was
that I
told that.
do
I
it.
was told
Yes,
that. I
but
asked, I actually asked the pharmacist. I went in, and they said that it was fine. So
yeah,
I'm like,
but but
you
there,
can have Dr. Nelson on here. So what are you stopping for? Because I'm like, girl, listen. Not she's not. No, I respect her. She's not a girl, but I was like, Dr. Nelson. I need to. Sometimes I didn't want to say anything because people would think it's weird because in my mental, had to have an Advil PM, and
every night. That's it.
yes,
Every night.
Really?
and in the
But
daytime.
But you know
yes,
what? If you start taking your magnesium supplements, that helps with relaxation and help with
And
sleep.
that's what he told me on Monday before.
Because every time you drink that coffee, you are peeing off magnesium and potassium. So
Mm.
you're losing so much every day. And before you drink your coffee, drink a bottle of water, because you didn't dehydrate yourself overnight. Now you're dehydrating yourself even more by drinking the coffee. So
yeah.
it's a diuretic. Coffee is a
Mm.
diuretic. So every night I try to make sure I take 500 milligrams of magnesium. But the thing with your liver, when you have diabetes, the sugar goes up. And if it can't get into the cells, it's going to deposit in the fat cells, and then it's going to deposit in your liver. So there's a thing with fatty liver with diabetes that we don't want to get, because if we can't control our sugar, it's going to have to deposit somewhere. So it's so many things you have to think about, but you need to replace with those supplements. And then take your D3, your magnesium and your D3.
And let me
K2.
also say this, because I am a supplement queen. I take
Are you?
all types of supplements, like a lot. I take supplements. And I think it also, because I still would take the Advil, and that's why we have to have, as a wellness tip, we have to address our stress. We have to be able to cope with it, because a lot of or our behavior, if you need to see a life coach or behavior specialist, because a lot of that Advil PM, it was just mentally, I need to take it to fall asleep. I need to take it to fall asleep. So there are other issues that we have to also address,
Yeah.
because like Dr. Jack, I take my I take my supplements. Anyone knows I take my supplements. But it was at night, I'm going to have that Advil PM, and it does affect, it affects my blood pressure started to elevate. It's just, it was a lot of issues. So I'm gonna be very mindful of that. And before I don't know how much time we have, because I know you ladies are very busy, but I do want to ask Dr. Jasper, what are some of the things that something that we can talk to our doctor about, some of the questions we can ask our doctor when we are going to, what are some questions that we can ask our doctor with reference to diabetes type 2 symptoms?
Well, you always want to know your numbers. So many people leave the doctor's office and don't have any numbers to shoot for. They'll say, "You're doing fine. I'll see you again in 3 months," and you don't know anything. You should know your hemoglobin A1C. You should know the range. You should know what you should target for. You should know the weight that you're targeting. You should know your LDLs, your cholesterol levels, and you should know your blood pressure. Those are the things that you say, write it down, let me know what they are, have your questions prepared before you always go in there for him. You want to know what tests are needed, all your preventative screenings. You have to have those schedule them early in the year, because sometimes it takes 3 to 4 months to get that. You want to make sure you have your kidney function. You want them to make sure they look at your feet. So many doctors aren't even looking at feet. Like, you didn't even take your shoes off. You want to make sure they're listening. You want to make sure they listen to your chest, listening to your heart. You want to not be afraid to tell them your symptoms. Do not be annoyed or thinking something is just trivial when you go there. And just make them assess it before you leave there. Make them write it down that they checked it out. Because we have one thing with being premenopause and going to menopause, that's a whole nother animal. Now you put diabetes on there, you have a lot to talk about, and they only have about 15 minutes. You see the MA more than anything. So once they're going over your medications, you need to know the signs and symptoms, the side effects of those medications. Let them know if you're experiencing any of those. Am I on the medications according to the American Diabetes Association? The guidelines. You always usually start off with metformin, insulin, or a GLP-1, and so many people are on GLP-1s and they do wonderful things, but you want to know, am I on the right medications? And sometimes some of the primary cares want to treat diabetes and sometimes they don't, and then they might refer you to an endo, and you have to see how aggressive they're going to be with your diabetes. And so I like that your numbers have gone down to in the fives. That's wonderful. You want to make sure you have all the knowledge you have around hypoglycemia, because that's the one thing that take you to the ER. You do not want to pass out. That's one thing. Juice will do it. Always remember the rule of 15. Drink you a glass of juice and check your blood sugar in 15 minutes. That's really every time. I would get a CGM. You know, they're over the counter now, those continuous glucose monitors.
Mm-hmm.
And ask your doctor, can you get one of those? And you know, he's not gonna say yeah, because not too many people prick their finger anymore. But that's easy where you can monitor it all day, and it helps you with some behavioral change. You can see your insulin, your blood sugar go up. So that's one of the new technologies. So many things that are coming about in the technology space for diabetes that can really help you and everyone. So I'm just happy to hear your story and where you are with that. And you're on your way. You're doing amazing. So now when you get to that spot, it's time to teach somebody else.
Yes, yes, yes. I have a niece, she's only 28, that was admitted in the hospital on last Sunday, that's going through. So on Sunday during service, her mom is panicking because she took her sugar level. Well, she went to the doctor 6 months ago, and she was, is, what is it, AC, what is it?
It's hemoglobin A1C. Just say A1C.
A1C was
Mm-hmm.
normal. But she has had some mental health issues. And so she's been like in the house, and I'm assuming in the house eating all of the wrong things.
Mm-hmm.
But she was admitted to the emergency on Sunday, last Sunday, where she's at 12, she was at 12.1.
Mm-hmm.
Um, my sister has been able to confide in me into like things that she can eat and things that she cannot. So on that Sunday is that when I had the low blood
Yeah.
sugar,
Yeah.
she had a very high one,
Yeah.
but it was like 187. I said, don't panic, because I said a prayer. I said, get her up. You got to make you got to put some movement in it. Like you gotta move. Like, and she said, okay, okay. So what to do? I said, do what the nurses told you to do when you left the hospital. Make sure you give her insulin. Make sure she eats. Once she eats, just calm down. Don't let her know you panicking. Calm down. Let her put on her clothes, and you guys go for a walk. She called me back after service and said, I checked it again, and it went down to 139.
Nice.
And I said, so it's trials and errors. And I said, I'm telling you, it's something about moving the body. I
Mm-hmm.
say you have to move the body until you get with the trial errors of learning what to do.
Mm-hmm. Mm-hmm.
I think we lost her again. She'll be back. Um, yeah, I'm glad that she is because I think that's why I think these support groups are so important, because we get to hear others' experience, we get to learn from what they've gone through, and we can help someone else. I For those that are, because we have a few people online, we have some people that just joined. Thank you so very much, and I'll make sure you get Dr. Jasper's information. And I'm so glad as a tool, as some of the tips, I'm glad that you mentioned walking, because that's like it exercises every muscle in your body. But I wanted to go quickly because I don't know how much time we have, the tips. But well, before we do that, Dr. Jasper, for as a medical information, what exactly is diabetes? If you can just sum it up, what exactly is diabetes?
Too much sugar in the blood
Okay.
that we cannot process without insulin. So your insulin comes out of your pancreas to bring your sugar down. But once you've eaten so much sugar, you start to wear your pancreas out. And it's like, I can't do anymore. I can't do anymore. And so it doesn't work as well. So when your insulin and your pancreas is not working as well, the blood sugar stays in your blood. and it can't go into the cells. The insulin helps the blood sugar get into the cells. But if you just ate an hour ago, the cells are still full. So it's going to float in the blood still. So you got to manage your meals properly so you don't wear out your insulin, you don't wear out your pancreas. It's a muscle. And if
Yeah.
it has to keep squirting out, it was like, dang girl, you're wearing me out, you're wearing me out, you're wearing me out, you're wearing me until it just says kaput.
Right. And
It's
what
not
is
coming
the
out, huh?
Oh, I'm sorry. And what is it? Because we know there are different types of diabetes. You have type 1 diabetes, which I always, as health education say, it's an autoimmune disease, but they're both serious. Type 2 associated more with our lifestyle choices.
Yes,
But I
yes.
don't like to separate. I know medically you have to separate them, but they're both very serious.
Yes, yes. But 90 to 95% of Americans have type 2.
Mhm.
So that's the biggest problem there. So it's diet, it's lifestyle, it's weight, it's all of that.
And I'm glad you mentioned early on the numbers of those that are pre-diabetic or that they don't know they're pre-diabetic. So that's why Michelle's story is so important, because a portion of the population, they're going to experience these symptoms and they're not going to know what it is. So that's why I wanted to have these conversations. Because if you think about 90 million people that may not know, because we don't have the numbers out now, but let's just know it's going to be a lot of people that don't know they're pre-diabetic, and that could propel them to being diagnosed with type 2 diabetes. So we have to have these conversations, and you have to know the signs or symptoms. Welcome back, Michelle. Listen, technology, we know.
But that's Miss Matima. So one of the things that keeps sticking out, and I'm going to keep saying it, her hairstylist knew something was going on.
Yes.
And so I keep going back to these people that can really help you get to the place, they notice. They notice the texture of your skin, your hair, what's going on. If they're doing a good job, they be like, wait a minute.
Yeah.
Something, you need to think about this, because you spend so much time with them.
Yeah, a lot, especially
You spend
me and
so much
Michelle.
time with them.
Yeah.
And so, who is better? They give you your therapy. They let you know what's going on in the world. Why can't they be your diabetes educator and your support and your coach?
That's right. So please, if you know of a hair salon or stylist, they have to, it's so important. They could add so much value to our healthcare industry by becoming a mind your business type 2 coach, or so we need them, because I go even some of the
I have a
salons.
whole list on my site, and it's mindyourbusinesstype2.com and mindyourbusinesstype2 on IG. But even CNAs, there's nurses and RDs that still need the education. It's a plethora of people that could benefit with their clients. Fitness coaches, lifestyle, massage therapists, like, just, you need this because you're taking care of these people.
Okay.
I want to interact if Dr. Nelson, if you all will allow Dr. Nelson to come on.
Sure.
She just mentioned on Sunday how so her ministry is to go out. We go out into the community, and we reach the people. We knock on doors, and so I want her just to come on and introduce herself, but she just spoke to me on Saturday. She's putting together, we've done a housing where we actually, from her financial ability, from the resource from Sanyetta SRL, myself, we didn't know exactly how it was going to work, but we took people that came into our homeless service, and they were put into. Some of them have like they're living in their own housing. They were able to do things that we didn't know. We was just giving them the guideline. But she just spoke on Sunday. She didn't know anything about what was going on today about me speaking, and so I just told her the other day she's my mentor. So I like to get her advice as far as what I'm doing. But she just said that she's putting together. She's like beauticians, barbers. I want nail techs. I want them to come in because they are so vital to our community. So if she would just come on, because that would be a great thing if we could collaborate when she does this, because she does entrepreneurs come in, whatever it may be. But if those people, because if it would had not been for my, and I tell her this all the time, if she had, I literally cried because I was like, girl, what you mean you're not gonna do my hair no more? She was like, no. It's something, it's something serious. She told me this is what it broke her heart. She said no. She said, I'm not doing your hair till you go to the doctor's
Mm,
office. So if she would just
mm.
come on and kind of collaborate a little bit where her idea was about doing that and how we can put that together, because that is so important. Like I would, I see people, I'm so afraid, not because, uh, well, I did find out about my sugar level, but even that when you go to the nail salon, I'm so afraid of them now because I have had issues not pertaining to diabetes, but where they cut and they do all this stuff, and then you start looking at your fingers and your hand, and it's infected not because of my diabetes, but because of the
Yeah,
cutting. They have been because of that. I don't know, but it is so vital. If she could just come on, Dr. Nelson, for 1 minute, please, and kind of incorporate what you was talking about Sunday. You didn't know anything. I didn't even think that was a vital part, that they become coaches and know if they're their clients. Because for me, wherever I go, I attend all the time. Dr. Nelson, can we have you for 1 minute?
Yes, ma'am. And I'm driving, so I'm going to be quick. Um, you took the words out of my mouth, because when the host or the doctor began to share how important that the hairstylist and the nail techs can be, I thought immediately about the building up of this program that we are embarking upon to bring the beauty industry along with the service industry together to do an appreciation service for them. Imprint Ministries, I serve as a senior pastor, and I believe that we were established to be able to bring communities together to make individuals and groups and communities informed. And so you guys have totally informed me of many things on today. Listen, I'm super excited to be able to collaborate and bring the health component to these specialists. They specialize in hair, they specialize in nails and massages. How we can make them aware and become a part of your team or your group that helps to make people aware of this concern, this illness. So yes, I'm super excited. Thank you. Thank
Absolutely.
you for this
Yes.
opportunity. Yes.
Yes.
And
That sounds great.
yes, and as Dr. Michelle mentioned, my publishing firm, I would love to collaborate on a diabetes um, book to educate people, because this thing is real and it's amputating individuals. My mother passed with diabetes. Her mother had diabetes. So, I have to be super, super
I didn't
careful
know that.
and conscious. So this has become something that I could definitely attach to and witness to as a collaborative partner in something of this nature. Thank you for this opportunity, and congratulations, Dr. Michelle. And thank you, all of you, for what you're doing in your prospective places.
Well,
Thank
thank
you.
you. Thank you so much. And I'm super excited. I'll make sure, please get Dr. Jasper's information. I want her company to just thrive, because we're not eliminating healthcare professionals, but we are providing, like you said, the hair salons, the nail techs with the tools that can add
Nurses,
value to your haircare.
aides,
Yes.
yeah, CNAs, anyone that needs the education that sees client serves people on a daily basis.
Yeah.
Like you're going to run into someone that's having a hypoglycemic episode or just pass out, but you need to know what to do. There's
Mhm.
so many things. I mean, we cover so much today.
Yeah.
In her story, we cover so much with hypoglycemias, hairstylists, weight, our social things in the Black community, what we struggle with, exercise, what to put in the coffee, all of these things we've covered it. We've covered eyes. So it is so much more to cover, but you can talk to anyone every day and they know someone. And it's not if we're going to get diabetes, it's almost when with the foods and process now. So we got to kind of wall that off and say we're not going to get it, and
Yeah.
and equipped ourselves with the knowledge and the tools to prevent that.
Yeah, I had a PowerPoint, but I don't need to show it because Dr. Jasper covered everything. And Dr. Michelle, your story was very inspiring and motivating. So I hopefully those that are watching, they will be even if they just make an appointment to go see their doctor or to be more mindful and to pay more attention to their body. So, and again, it's mind your business type 2. I want everyone to be familiar with that company. Help us spread the word because again, I want this agency to thrive. Dr. Jasper is very, very valuable. She has just a wealth of information. You want to learn from her. And again, you'll have access to her if you take this program. And not only, also let me, before we go, because I have to mention that because this is when we talk about cultural barriers to diabetes. One of the things I see in the African American community is religion. So even some of our pastors, I mean, we go to them for healing and things like that. They shouldn't be more mindful, and they should also be equipped with the tools to help us. Because I always say we can't pray. You should pray. We have to pray, but we can't just pray diabetes away. There's some education and some resources that you have to be aware of. So you can reach out to your spiritual advisors, your pastors. They should be able to take this program also. So yeah, I just had to mention that because a lot of people they're not taking care of themselves because of a religious barrier, and I don't like to see that.
Absolutely.
And I have
Absolutely.
one more person. I
Okay.
think that's my nurse is on here. Is that nurse Blessing?
Okay.
If
Hey,
that's nurse,
Blessing.
is that nurse Blessing?
It says Blessing, yes. Beautiful name. Hi,
Hello.
Blessing. Hi, Nurse.
Hey.
That's who
Good
I wanted you to
afternoon.
meet, Miss Jackson. That's her. She has been.
Okay.
Listen, I called her and Sunday night with her kids in the back. I was losing it. I was like, she has taught me so much. If she can have a minute just to speak on, she has more information about the study. But whatever she want to speak, can she have a minute, please? Thank you, Nurse Bless.
Absolutely.
I
Hi,
love you.
Nurse
Thank you.
Blessing. How are you?
Hello.
Hi.
Okay.
Thank
Thank
you.
you so much. Thank you so much for having me. I'm actually seeing patients. My lunch break, I was like, let me see if I can still join this because I really want to join this. Well, my name is Blessing. I'm a nurse practitioner. We are here in Atlanta Family Physician here in the Canada Road, Decatur area. My specialty is adult gerontology, but I've been blessed to work in clinical trials. So I met Miss Michelle. Oh, Miss Michelle. Please, you're gonna make me cry too. uh, I met her actually when she came in here for her diabetes follow up after she was in the hospital. And I was lucky enough to see her and I approached. She was like, have you tried clinical trial before? And she was like, what is that? And we have this bias about clinical trial, even among our community as African Americans. So I understand it. I understand it. And now with the FDA pushing with pharmaceutical company to make sure that you have that diversity inclusiveness when it comes to developing medications and doing clinical trials, it's really important that we participate. So for me, being able to be available to answer people's question and not just try to say join the study, but also try to understand why you don't want to join the study and what is your knowledge and your background or your previous experience about it, joining any kind of study. So it's a pleasure for me doing what I do, and we've been blessed with the study that we're doing right now. Is a diabetes study. We have a type 1 and a type 2 diabetes study. It's a Lilly pharmaceutical study, so we're looking at patients with type 1 diabetes as well as type 2 diabetes or with history of chronic kidney failure. So Miss Michelle has been lucky to join. It's an ongoing study, so I really can't say much about it because, like, it's a clinical trial. It's a phase 3 study. The drug is not out yet, so I can't say defensively whatnot. But I can say that all the patients that participate in doing clinical trial, they benefit from it. They did. At least the ones that I've worked with, I can say defensively. And even from them, I've learned as well that the fear, this fear, even though the doctor has prepared this medication for you, that it works, you're afraid. You don't know. You don't know if you go to sleep and your sugar drops, what's going to happen, or if your sugar is too high. And for Miss Michelle, fortunately for her, it was new for her. And I've been lucky enough to work with her one-on-one. She has my phone number. She can call me anytime. And she's knowledge. She's educated. So it's not like she's not educated, but then it's a new thing for her and just even understanding it. So it's been a pleasure for me working with her and an honor. Thank you so much for having me here. So thank you, ladies. I really love what y'all are doing because information is the key. It's powerful. The hairstylist thing, I'm like, wow, I didn't think of that. This is a thing, and it's true. I try to teach our diabetic patient when they come in, definitely they do get their nails taken care of. I'm like, no, don't go in there because you don't know the bath that are soaking it in. It's pretty, but you don't know if it's sterile or if it's clean. Go to a podiatrist instead, at least once a year. Little things like that. So getting the community involved, it's a beautiful thing what you guys are doing, and thank you so much for having me.
Thank you, Nurse Blessing. Thank you
Thank
so,
you.
so
Thank
much.
you.
Thank
You guys
you.
don't
I'm
know this
glad
lady
that you
Esther.
mentioned. I know we probably have to go. We have 2 more questions, but I'm glad that you mentioned clinical trials because that's another barrier. And I don't want to offend anyone, but I always say we kind of come a long way from Tuskegee, but I understand the hesitation. So, but until a part of trying to get better health outcomes, we do have to, these studies are very important. So thank you so much for what you're doing. And this is, I'm gonna take this last question. It's one of my support group members, and I guess that they may want to rat me out too. But I said I've spoken with people about, so there's different types of insulin. Some fast acting, some slow acting, Dr. Jasper. And I don't know if this is, I just want your opinion because I always say you have to take the one that's best for your situation. Because some of our seniors, they have a set schedule. Now, my truck drivers, they're on the road. They don't have sometimes access to healthier food choices. So should they be having these conversations with their doctor on the type
Absolutely.
of insulin? Okay.
Absolutely. Absolutely. So I think the most important thing is to keep a journal of your blood sugars to understand the patterns so they can put you on the type that is best for you. You have your long acting, your short acting, you have your mealtime. And usually, nowadays, even with the American Diabetes Association, GLP-1s are preferred more so over insulin. So it just depends. And sometimes it's insurance driven also. But some people have it and then they're getting it off of it with GLP-1s because sometimes it's hard to manage. And the longer you stay on insulin, it's harder to get off. So there's many things that you can have those conversations with your doctor about. So I would always jot down those questions and how it's making you feel. And if you're having a lot of lows with it, how can they manage it? And can you do something once a week? There's so many things coming out. And I was interested in seeing what your nurse Blessing was coming out with. Is that oral GLP or something? Because when she said Lilly, they're doing something good because they're behind Mounjaro. And I love that medication. It does wonders.
Me too. Well, I'm gonna get ready to close it out. If you guys missed it, it's okay. I'm gonna put the recording on YouTube, or you can go to Facebook. It's just I know we can talk all day. I know you have so many questions for Dr. Michelle and so many questions and want to just talk to Dr. Jasper, but we just don't have the time right now. But you can consider her program, Mind Your Business Type 2. And how can they find you again? Mind Your Business Type 2. What is that website?
So IG is Mind Your Business Type 2.
Okay. Okay.
And then website is mindyourbusinesstype2.com.
Okay.com. So if you're interested in learning more about her program or consultation, make sure that you reach out to Dr. Jasper. I want to thank both of you ladies. Dr. Michelle, thank you so much for being so transparent and reaching out to me and sharing your story. I know it's going to it's going to change lives. This is a life-changing story. Sometimes we do ignore our bodies, and I'm glad that even though I was like, you went to the family reunion, what? It's okay. You were able to go.
Too.
Yeah. You were able to, you're here to tell the story. So we want to continue to increase awareness of the seriousness of type 2 diabetes. And so you have information on the symptoms, you have some information on what you can do to as far as a wellness tip. And if you need support from a diabetes community organization, the Ruby A. Neeson Diabetes Awareness Foundation, we're here. We can engage you if you're in the state of Georgia, or if you are not in Georgia, we have virtual support sessions, and we want to, our goal is to help the whole person, not just your physical health, your mental health, your social health. You have the right job. Is your job good for your health? So we want to praise the whole person. So we offer diabetes support groups. We have cooking classes, fitness programs. I am a health advocate. I believe in raising the voices and the concerns of the community. So if we can be a support, please let us know. And I look forward to seeing you ladies in the future, because I know the future is great.
This is awesome, Miss Jackson
you.
Matima. This is great. Thank you so much. I enjoyed everyone. I thank you, Dr. Evans. It's been a pleasure. Dr. Nelson, it's been a pleasure.
Thank you so kindly.
Okay, guys. So remember to mind your business. Type 2. Okay. See you
Take
later.
care of business, everyone.
Thank you, guys. Thank you.
Okay.
Bye-bye. Thank you.
Bye-bye. Thanks, Fatima.
Thank you, Dr. Lisa. Lovely Lisa.